Good morning. Good morning. So glad to have you here as a part of our group this morning. Looks like we've got 1, 2, 3. And I've got Lisa and Julie and Chad in here, correct?
Yep. Good morning.
Good morning. We'll just give a quick another couple seconds and then we'll get started. Chad, thanks so much for sharing today.
Yeah, great job, Chad.
Okay, we're going to go ahead and get started. Welcome, everybody. So glad to have you in our breakout room today. This is surgical services, or what we call peri-op services, I guess also known as AKA. My name is Karen Vogel. I am the HR business partner here at Bryan, one of 6, 5, 6. But I'm going to talk about, let the managers talk about the 2 areas that we have here, which is the PACU and outpatient, and then also for the surgical rooms, the ORs. And I'm going to share my screen. Here we go. This is always a challenge, but we'll do it. Oh, I bet this one. There we go. There we are. Okay. Hopefully everybody can see that. And with that, I am going to go ahead and turn this over to Julie Smith. Julie, can you hear us? Uh-oh, we don't have Julie on. Okay, so I'm going to turn this over to Lisa and have Lisa start us out today.
Okay, perfect. Good morning, everybody. My name is Lisa Hittner. I'm the nurse manager of the Bryan West PACU and pre-op and outpatient surgery. I've been a nurse here at Bryan for 19 years, and my time here at Bryan has consisted of ICU nursing. That's where I started out. And then I moved over to the PACU and was a PACU nurse for several years. And after that, I became an A&M in our PACU. And after my A&M, I became the nurse manager in the PACU. So I've been the nurse manager in the PACU for about 4 years now. And that's kind of where I am at this point in my life. So if you take a look at the pictures, you can see some pictures of our PACU team and our PACU environment. Down in the lower left corner, you can see a picture of one of our West Campus PACU bays. Some pictures of our outpatient team included in there as well in our pre-op area. Currently, right now, we have 10 PACU bays in our area. A couple of those PACU bays in our PACU are isolation bays. So we're able to house COVID patients in those PACU bays, or any patient who comes in who may need any isolation precautions, including a patient who may need to come to pre-op for a procedure. We have 5 pre-op bays over in our pre-op area, but none of those are set up for isolation patients. So in the event that a patient needs to come down for a pre-op procedure and would need isolation precautions, we would bring them over to our PACU area and set them up in one of our isolation bays across in the PACU. Right now, on any given day, we're typically running, just depending on the day, around 30 to 40 PACU patients. So we're fairly busy. We're set up to run about the same number as what our East Campus is running at this point in time. So we're pretty comparable in terms of the busyness of the day. We are on the West Campus level 2 trauma center. So we will see things like neuro patients, trauma patients. Obviously, we see a lot of plastic surgeries. We do have general surgeons who work on our campus. We have a new ortho group who's begun practicing at our campus here in the last year. And so we do see a lot of total knees and total hips. We have a lot of pediatric patients, not a lot, but we do see some pediatric patients. And I would say that one thing about our PACU, and I would say this is one thing that our PACU nurses really love about PACU, is the variety of patients that come into PACU. I think that no 2 days are the same in the PACU. You would see, just tons of different cases. You might take care of ICU cases. You may take care of general care patients. You may see pediatric patients. We go over on Monday, Wednesdays, and Fridays to the mental health clinic and take care of ECT patients. We do float over to East Campus and help them out, and they float over to West Campus. You may see a C-section come in, so you may find yourself in a labor and delivery type of situation. So I think that most of our nurses love the variety. If you heard Chad speak earlier today, you still get to go up and interact with the different nurses on the floors, so you still get a piece of that too. And so that's really attractive in our area. I think our culture in our unit is very team-like. You get a lot of independence in the PACU, but whenever you're getting a patient in the PACU, you'll find that your team is surrounding you and helping you. You're always able to bounce ideas off of each other, and you work really closely with the anesthesia group and the CRNAs. And so that relationship is really unique and great. And you don't see that anywhere else in the hospital. So that's really cool. Let's see. I think another really neat and unique part about the PACU are the different shifts that we work in the PACU. We stagger in and stagger out of PACU. So our shifts start as early as 6 o'clock in the morning, and they run until 2200. We have 2 night nurses who work and cover 6 days a week, and they start at 1900 and go till 7:30 in the morning. But we offer 12-hour shifts, and we also offer 10-hour shifts, and we offer 8-hour shifts, and we offer 7.5-hour shifts. So that's something that you don't see really anywhere else in the hospital. And a lot of our people work part-time. So it just gives a good opportunity for people to have better work-life balance in that opportunity. So that's something that's probably really unique about our unit as well.
Great. Julie, are you able to connect with us?
I know she was having battery issues with her laptop.
Yeah.
She said may not be able to.
So I'm going to go ahead and jump in here real quick until we can hear her, perhaps.
Okay.
So this is a picture. These are pictures of our East OR. Julie mentioned earlier that these are actually mimicking or looking very similar to what we have on our West Campus. So you can kind of see that these rooms are very large. They have nice big brand new booms. You have this room set up so that it allows for a really good workflow, which obviously is in the best interest of the patients. I know staff had a lot of opportunity to give input into these rooms as well.
Mm-hmm.
I can kind of hear Julie coming in now. For our East Campus, we do have right now 14 rooms. On West Campus, there are 10 rooms. We do have 3 more in our OB tower. We also have an additional 3 rooms coming for cardiothoracic and vascular rooms by the end of the year on East Campus. They are busy, which is a great thing because we're helping people.
Mm-hmm.
I think you get a lot of variety also in the ORs. Even if you specialize in neuro or in cardiac, you still get to float over to the side so that you can be a part of many different pieces to this, which is an awesome learning opportunity just to keep your skills up and keep changing your skills around for those who are interested in just being able to handle whatever comes your way. But they do specialize, so you do get the opportunity to be in a specialized area if that's what you like. If you like orthopedics and you like to do orthopedics, you have the ability to do a majority of those cases. But then again, kind of spread your wings a bit. So, yeah, so that's what we're here about. If Julie were here, she would tell you that she has been here for 30 plus years. She started as an RN. She also took on a manager role over med-surg, one of our med-surg units. She has gone to the OR as a nurse manager, and then she is now currently the director of Breakout services. So that's a little bit about those. Lisa, did you talk about how you got to where you're at?
I did.
Yeah.
Yes.
Perfect. Yeah. What kind of questions do we have from folks? You can go ahead and just unmute yourself and ask a question. That's all fine with us. No questions from the crowd?
What areas are people interested in? Are you guys interested in the OR or in PACU or outpatient surgery? Any particular interests in the group?
I'm going to stop sharing my screen here so I can. All right. It's a quiet group today.
It's a quiet group. Okay.
So, trying to think about some questions people might have. So, about benefits here, we do have the wide array of benefits that other organizations will have. So, medical, dental, vision, life, all of that 401k. We also have an EAP that people can use. Lisa had mentioned this earlier, and it's a great point. With COVID and people not being sure of their finances, they're able to get help with that and actually talk to somebody who can give them great advice. It's not just for emotional, but it's for financial support and different things that you might need. We're one of Lincoln's largest private employers. And so with that, we get a lot of different discounts throughout the city, throughout even the nation, if you will, because if you have a cell phone through one of the 3 services we have discounts with, you can partake in that. We have different things that happen throughout the year as well. We celebrate our employees by having different on-site celebrations such as Hospital Week. We recognize milestone anniversaries. We also have different events that happen for families. So we had a Cookies with Santa where people could drive through. Obviously with COVID, we couldn't be in tight quarters, but people could drive through and have a maze, if you will, with their car and see Santa and see the reindeer. And it was very well attended. People loved having that opportunity because their kids weren't going to get an opportunity perhaps to see Santa otherwise. We have great senior leadership support here. I think probably the biggest thing why people stay for so long, and we have a lot of longevity here, is that we feel like family. A lot of the departments, and I will say peri-op services in particular, you start feeling like you're part of a family here. They really care about you. You saw that a lot during the pandemic. I think we see that a lot just on an everyday basis, but they care about how you're doing. They care about how your family's doing. You get to know people. You get to understand what's going on in their world. They understand your world, and you really come to rely on them.
Yeah, definitely. Brian just has a unique feel to it. I've talked to people who've left the organization and come back and said, things to to that feel too, where it's just Brian just has a different feel to it. And, it's just a great place to work. So it definitely, it's just a great place to work, I guess. And, and there are other things, if as a new person coming in or as a student, in our organization and in the OR or in PACU, we have things that people can be a part of. We have a nursing professional practice program. We have unit-based practices, different teams, different programs and things that you guys can sign up for, and committees that you can join and be a part of to just be active in the organization and be active in the work group to stay active in those types of things too, so that can be attractive to, especially to people coming out of school and just wanting to be involved in the units and stay active.
We do also have a really nice education tuition reimbursement program,
Yes.
certifications, and for additional degrees that you might want to pursue. I think that by allowing folks or encouraging folks to get additional education where they want it, really lends to, I think, that uniqueness of our organization. We don't tell you have to have certain things in order to move on. You can try different departments, you can try different areas till you find your niche. And then once you get there, you can continue to grow and continue to, like Lisa mentioned in her talk earlier today, really get those certifications that mean something to you and pursue those degrees when they're appropriate for you. And I think that's a great opportunity. So, do y'all have any questions for us? You can use the chat. I'll monitor chat. I can see it right here. So, and Chad, do you have anything to add to our discussion?
Yeah. Anything you want to add, Chad?
Sorry, I was muted. I mean, I think, yeah, most of you guys have said it. I mean, the career opportunities at Bryan are exceptional, and the managers are always, they're encouraging you and challenging you, and they want nothing but the best for you, and they want to see you grow and excel in your role as a nurse. And so there's so much of that. And I like I said, I've worked in 3 different departments, and I've seen it in every department that I've ever worked in. But the PACU so far has been a welcome change, just in the fact that you get to do one-on-one nursing with your patient, and you get to interact with, the house supervisor, the bed control people, all the nurses, and the charge nurses on the floors. You get to interact with all of those. And so it gets you just out and about in the hospital while you're still doing patient care, which is super cool.
So we did have a question. Are all the positions 12-hour shifts, and are there any outpatient opportunities with Bryan?
Okay. So right now I have one position open in my PACU, and it's a full-time 12-hour shift night shift position. Not all of my opportunities that come available in the PACU are 12-hour shifts. We will at times have 10-hour shifts, 8-hour shifts. I do have a 7.5-hour shift occasionally. Right now in the OR, I can't 100% speak for what is open. I don't know, Karen, if you know for sure, but they do hire 8-hour positions in the OR and 12s also. So they may have some of those positions open right now if you look. Right now, I do not have any open positions in my outpatient surgery area. When I do hire into my patient surgery area, I often will hire 8 or 10-hour shifts, and those are typically day shifts. It's a pretty competitive area in outpatient surgery. I find that when I hire somebody in there, I've got a lot of longevity over there. People get there and they stay there for a long time. I've got people who've been there for upwards of 30 years. So those positions open up and they kind of close up really quickly, but not to say that I never hired there. So I did just hire a couple of people. So just keep your eyes peeled for those types of positions. They do go really quickly when they do open up.
Yeah, I'm not sure what East or West has for open position, or I'm sorry, East has for open positions in their outpatient. But that is something that would definitely be on our website. So
Mhm.
bryanhealth.com /careers, I believe is what the page is. And
Yeah.
those should be listed right there. If you have questions about opportunities that we have or when they come available, feel free to reach out to us. We would definitely be happy to reach back and let you know kind of what we see coming down the road. Because sometimes we know of things that aren't quite posted yet, but we know they might be coming. So
Yeah. Mhm.
good question. Other questions? No questions. Um, what else can I tell you?
Hmm.
I think the biggest thing is if you do have any kind of questions, or if you think, gosh, I'm not really sure if I would like it or if I wouldn't like it, or, have any of those kind of questions, if this is either your first job out of your education, right into your new license, or if you are experienced, but you're still not sure about the position or even about Brian, give us a call because I know that we're starting to open up a bit more for shadowing opportunities. I don't know for 100% yet, but we would certainly, I know that we could do a virtual tour with you and
Mhm.
to one-on-one and have you talk with the managers one-on-one, and they can kind of give you that virtual tour of what it looks like and kind of how that feel is. Those are difficult, but not undoable.
Right. Definitely.
We are really, really excited to have people come in and see more about us and listen to more about us and ask more questions of us because
Mhm.
we have a lot to share. I think you can probably feel the excitement that we have for this organization. So, we'll talk about anything. So, I don't even know what time we entered our room, so I don't even know how much time is left.
Don't remember either.
We have tech cafeterias on both campuses. I guess I could talk about that for a minute. Most of
Huh?
cafeterias in the hospital don't provide the kind of food we do, but we've got fantastic food. If you like noodle bowls, we've got them. If you like pizza out of a pizza oven, got that too. Have all the healthy options. We have an executive chef who has won many awards for his ability to create and serve very healthy and very unique foods. And I think that's probably one of the things that is different about us than a lot of places is that we don't have just a food service coming in and doing it. We actually have people making the foods here. So let's see, what else? We braved the cold and the snow and everything. So
One other great thing that happened during COVID too, we were challenged during that time. Surgeries were restricted, and we faced not knowing for sure what was going to happen during that time. We were, not having the volumes that we typically would have at the end of the year because of COVID. But Brian really had our backs during that time and made sure that we had work to do, whether it be, doing ancillary jobs or making sure that we had, some of those outpatient surgeries still did continue to happen, but they just made sure that our employees were kept whole by, doing just different things, temperature screenings, going out to the tents. And my employees really appreciated that at that time. It was a very scary time that we weren't really sure what was going to happen, but Brian really had their backs, and they were so thankful for that. And I know, as an organization as a whole, everybody was, but it was scary in surgery, and our employees were very, very grateful. So it's just something that, taking away from that our employees were ever so grateful. And it just speaks to the organization as a whole. They will always have our backs. We know that our senior leadership is wonderful. They're so transparent. They will always be honest and forthright with whatever they can, and that it just is such a sense of security for employees. And it just makes you feel so good as an employee to know that they're going to share with you and be honest with you what's going on. And just it gives you that sense of security, and it makes you just feel safe. And so that's something about our organization that really is great, and I feel very unique. I don't think that you can find that at any other organization. So that's something that you can also take to heart, I guess, as you look at places, and just know that that's something great about Brian.
I would agree. Yeah. Lisa, there was a lot of times when I think people had some angst about what's going to happen to my paycheck, what's going to happen
Yes.
to me. And the fact that our leaders took so much time and effort to make sure that people could remain as whole as possible,
Mm-hmm.
even to the point of supplementing checks when necessary.
Yep.
The caring and compassion here is amazing. It's
Yeah.
not just for the patients.
Yep.
It's for our employees.
Yep, definitely.
Yeah. What else?
Anybody have thoughts or questions? Anything that's come to mind as we've been talking and sharing? Anything that you guys have out there?
One of the things too, I think, and you may have heard it in Lisa's Vale's talk, she's very down to earth. They really know what's going on the floors. They keep themselves very aware of what's happening in your world. And I think that's really important too. You don't have people who are leading, but leading for a different reason. They're leading because they have a big office in the C-suites. That's not our leaders. Our leaders are people who know what's going on the floor. They're willing to come up and have conversations and meet with folks and understand what staff are going through. They learn your name, which is amazing in an organization our size. When you have the CEO or the CNO come up and say, "Hey, how you doing?" and they call you by name. That doesn't happen a lot of places either. So,
In fact, Lisa Vale just came through our unit in the PACU on Friday just to kind of see how things were going and stop by to say hi and check in with us on Friday afternoon. So, I mean, that happens. She just, wanted to say hi and see how our Friday afternoon was going. So, they're very personable, and, they really do, want to truly, connect with us. And that's, great.
I think that's important, to be a part of a group, an organization who care. And they're people. You're not afraid to talk to them. They're never in a place where you can't have a conversation. So. Everybody's so quiet this morning. It's Saturday. Hopefully everybody's thawed out from the bitter cold.
I know. Yeah.
We do keep growing too. So there's always continued opportunities here. It's not like if you come on board and you decide, gosh, I really want to try something new, we've always got new opportunities. So if you haven't heard about our new cancer center that we're building, that will be going up here within the next, I think they've got a 2 or 3 year plan on that one, but it's going to be phenomenal out south of town. So, we've got those opportunities. You've got opportunities to go from East Campus to West Campus. You've got opportunities to go to our critical access hospitals or, things like that. So you learn a lot here, and you may find a great home, or you may find a great place to start and then find something else that you have a passion for.
Mhm.
So that Periop Services is a fantastic place to start. So if you have a passion for that, we would love to have you join us. I wish I knew what time we were coming back.
I think I saw a message saying a few minutes ago that there was 6 minutes left,
Okay.
and that's probably been about 3 or 4 minutes ago. So I think we're getting close to
We're getting closer. Okay.
Yeah.
So just to kind of give you kind of a quick where we're at, after this breakout session, we'll go back into the main room, and they'll talk about the nurse residency and kind of about its success and so forth. And then you'll have an opportunity for general question answers. So that will be your opportunity to ask any questions of anybody. So hopefully you've had the opportunity to do that as you were in your first session as well. So did we answer everybody's questions? Did we have anything?
Any generic questions about the organization? If not, specifics about the surgical services, anything that we can touch base on for you before we leave? Okay.
Well, I'm trying to think if there's any other things we were going to share.
Well, I think just some, before we leave, I think some just generic interviewing tips. Just be yourself, come in relaxed, smile, make sure you are professional, use professional attire when you dress up. I think come prepared somewhat in, that you think about maybe some of the questions that might be asked of you. When I do interviews, I look for some eye contact. I think that's important. And I think just, some genuine answers. I often will ask questions and ask for examples in my questions. And I like it when people can give me some examples. They don't always, have to be nursing related. I think people get stuck when they can't give me a nursing related example, but that's not necessarily what I'm looking for. I'm just looking for any kind of an example that's helpful. So if I could give any advice during an interview, I think if you can kind of think through some work examples and come with those, that would be helpful. So I appreciate you guys coming in and today and listening to us.
Definitely. If you have questions after this is over and you want to reach out to us, please do so. Please reach out, and we'll be more than happy to answer any questions you have. So with that, we're just a few seconds away from being in the next room. So I'll see you later.
All right, thank you.